last year. And I know some of you have traveled a great distance to be here, so really thank you so much. Beside me, standing very modestly, is Raj Chetri. And some of you might know Raj. He's been nursing for 39 years. So since yay high. And he's going to help me to introduce the project and the day's program. So as you know, the project is called Reach Out Conference, and we named it that because it is very much about recovery, community hope, and trying to become more open as a service, more understanding, and more tactful about cultural issues. So like I said, that's my name, and Raj, we're both from Syrian Borders. And I'll hand you over to Raj.
Good morning, everybody. Hello and namaste. I hope you can hear me. My pleasure for being here is I see so many people interested in early intervention. I'm going to say a few words. I've been told to speak a bit quicker because of the big program. So I'm going to just say what I usually say, place like this, in this kind of meeting. Early intervention in psychosis. Ladies and gentlemen, my introduction, namaskar or namaste. It is with the greatest of pleasure I thank Sarah Amani and her EIIP team and our employer, the Syrian Borders Partnership, for giving me an opportunity to say a few words. So here I begin. In March 1854, Crimean War started. Florence Nightingale left England on 21st of October 1854 for Barrack Hospital at Scutari and arrived there on the 5th November 1854. She didn't take Ryanair. At the same time, there was another nurse of Afro-Caribbean origin caring for the wounded British patient. She was never mentioned in history. As you can see her now, is Mary Seacole. Today we are gathered here because of Mary Seacole Award won by Sarah Amani, a Malawian nurse who dedicated the Mary Seacole Award money for the very noble cause for training community health ambassadors. She sought Nepalese volunteers to be trained on the merits and the benefits of an early intervention in psychosis and its propagation in the Nepalese community in Rushmore. The most efficient and positive ways and means of reaching the community is through the community health ambassadors from that community, so that stigma about mental health issues could be conquered with positive signposting through words by mouth in the language of potential service user. Very important point there, please bear in mind. As a former Gurkha line boy, I salute Sarah Amani, members of her team, every one of them, the CEO Fiona Edwards, and the Executive Board of Syrian Borders Partnership for making this noble conception into a reality. Such determination, hard work, and selfless dedication of Sarah and her team consolidate the very pioneering adventure that makes mental health service so exciting and enticing. Never a dull moment, I can tell you all this 39 years.
So she took it upon herself to start campaigning in 2007 for the rights of ex-military men to have the same pensions as British Army. Okay, all right. So obviously we know that that was successful and the residential rights were then changed. And I've worked in this area for 6 years and I've noticed the changes that campaign made. And I started to see things in the newspaper about some struggles and some challenges that the newcomers were facing. So we fast forward to 2011 and similar stories of discrimination, overcrowding, a lack of perhaps awareness of how to navigate the complicated systems that we have. And kindly, Dr. Marie Casey over at NHS Hampshire Public Health compiled a 107-page health reports just on the Nepali community and their health needs. So in the terms of research that was really useful to then see what some of the challenges really were in terms of health. So we thought we'd add to that story because the negativity was getting a bit much, so we thought we'd put a positive twist to it. So we thought we'd actually go out there and see whether we could get some funding to make our idea possible. And the idea, in its simplest form, is to empower the community to help itself. So a little bit about Rushmore. I'm sure Peter Moore will do better than I can. But as you know, this is a military town, and where the team is actually based right smack back in the middle of it in Aldershot. In terms of population, at the moment it's estimated that there's 91,000 people, and of that, again, an estimate of 15,000 are of Nepali background. Now, the interesting thing about South Asians and the Nepali community, when you read the research, is that the family is very important. They're very close-knit. So it's only natural then that when people experience any problems, whether it be mental health or physical health, that they seek help from their family and friends. But then that's where sometimes the story ends, unfortunately. So our guiding principles for the project were very much about, we very much believe that everybody should have the freedom to reach their full potential. And we thought the state of play at the moment doesn't actually allow that. And we thought this would be a great opportunity for people to take part in changing that state of play. So just a quick run through of the legislation. The Equality Act, which came out in 2010, which puts a legal duty on all of us to be as equal and fair as possible. The No Health Without Mental Health momentous policy from the government, basically saying we can't separate people into these entities, we have to look at people as a whole. And from 2004, World Health Organization released this, and this is the early psychosis declaration, saying that we shouldn't wait until things are at crisis point to help people. It doesn't make sense. So our aims then, briefly, to improve health and social outcomes, to make access fair, and also to empower people so that it is very much for the community, by the community, with the community. I've been told I only got 5 minutes, so I'm going to speed. If I make you sick, do tell me to stop, because this thing does run around quite a bit. So why did we set out to do this? Didn't we have enough work on our hands? You know, were we bored? And the answer to that is a definitive no. What we noticed, though, was when people of the Nepali background were entering our service, they weren't coming through the informal route. They were typically going into hospitals as the first point of call. Now, what that does to a person, unless there's anybody in this room who's very, very different, hospitals are not always pleasant, whether you're talking about a physical health hospital or a mental health hospital. So already we're starting off not on the best footing. And also, it's not the cheapest way to actually help and treat people. But we couldn't just run off and do whatever we liked. So we actually started off by listening to people's views, and the people fell into 3 categories. Most importantly, the Nepalese community. And they told us that our services are complicated, hard to access, and that they were embarrassed to ask for help, and that there were also language and cultural issues. Reading some of the Rushmore literature, there were certain concerns about the influx, and also really no definitive figure of how many people had moved into the area. And a big question mark as to whether we're actually facing an impending health and social care crisis. And as for us, we were thinking, how do we delay this, how do we reduce the delays in treatment, provide fairer access, and reduce health inequality? So our intended impact for Rushmore, we want to raise mental health awareness, because we think if people are aware of where they can get help, at what time, that reduces the delays. And we've been working very closely with Nayuva. Sheila, do you want to give a wave? All right, so that's Nayuva over there. And Nayuva, for those who don't know, is a youth group, and they do remarkable work to raise funds for the local community and beyond. And Sheila has a full-time job, but somehow she manages to fit it all in. And then there's the other agencies who joined us on this crazy journey, from IAPT to Rushmore Borough Council, Insight Forum, Home Treatment Team, Dr. Fairbairn, who can't be here today, one of the local GPs. And in a way, I suppose we lured them with pizza, but it worked, so there you go.
And pancakes.
And pancakes. So what do we gain? Well, I think we have gained a remarkable amount of understanding of the cultural nuances that we weren't even aware of before. And by working closely with other agencies, we can now pick up the phone and talk to other agencies without hesitation or barriers and that sort of thing. And we're trying to share some of that learning through publications. So in June, Community Practitioner, which is a journal that goes out to health visitors, food nurses, etc., has actually featured the project as something to consider in other areas. And what do the organizations gain? Well, reputation and credibility as responsive providers and employers. And also research-based to inform other projects and improved quality care and cost savings, hopefully, in the long term. I'm being told I'm out of time, so I'm going to... All right. Right. So what are the community health ambassadors doing? Well, this picture was taken recently in March at Runnymede near Chertsey. So this is the typical thing that community health ambassadors are doing. They're being visible, they're going out there at events which typically attract 1,000 or more people, and they're talking freely and openly about mental health being just as treatable as physical health, and that the shame and stigma is not something that you need to permanently carry. I'll skip over the stages if you don't mind. Now, we had planned to share, obviously, through publications locally, nationally, but what really surprised me in April was that the Americans got interested and invited me over to Washington. And it was interesting to hear that they have taken the same concept and applied it to Alaskan Inuits, to Native Americans, because they are actually aware that the ways that the Western medical system operates is not always acceptable.
Namaste. And Raj tells me that this means, one of the meanings of this is, I salute your being. And I, bless you, and I cannot think, I'm going to grab this phrase with both hands, I cannot think of a nicer way of expressing how we want to work, simply by, first of all, recognising and saluting someone's being, and now how are we going to work together to help you fulfil your potential. So even this morning I have learned something incredibly valuable so far. So we come to Sarah. What can I say? She is actually so active and has so many fingers in so many pies that we regularly check her for illicit drugs. In fact, today is one of your random days, Sarah, so... it's always proved negative so far, so the coffee in our office must be industrial strength to keep it going. You're probably all sitting there thinking, my word, what an energetic woman. Not only has she achieved all this, she has massive plans for the future. She is a multi-award winner, and she is also developing a school in Malawi for which she has just spent a month doing without her car entirely. I cannot tell you how much I look up to Sarah. I will never live up to her example, but she does inspire me, and it is wonderful. Could we have another round of applause for Sarah? Now, the wonderful thing about working with Sarah is she's one of the very few people who understands me. I'm not going to say my wife doesn't understand me. That's not the right place for that. That was last night. No, she works in the same ethos as me. Things like what people say is not what they do. Good intentions don't always lead to good results, and going against the grain is often the correct thing, even if people are telling you that it's not. She's one of the only people who takes my ideas seriously, probably because they're nearly as off the wall as hers are. It's led to all sorts of things, including Sarah coming back and saying, you had that idea to me, and me saying, oh, did I? I'm very, very lucky. I spray ideas off, and she picks up on one or two of them and runs with them, and I'm extremely grateful to her for that, because I wouldn't be able to. Now, what that's leading up to is that everyone taking part in the Community Health Ambassador scheme is doing something really radical. And I mean the health professionals, the CHARs themselves, Sarah and Surrey and Borders for sponsoring it and encouraging it to happen, and also all the other awards, the award granting bodies who have enabled the work to happen. And it feels so normal sitting here with people who have put themselves forward and undergone rigorous training and are now going to go out and do this work. But I can tell you it isn't. This is absolutely fabulous, but very unconventional. And you will hear people, you will hear health professionals saying, oh, we don't need them. But as I said, good intentions don't necessarily need to.
I probably don't need to tell you this, but I think we've split one, haven't we? Yes. Yeah. Farnborough is the birthplace of aeronautical research and development, and we're very proud of that. As we are proud of the fact that it's the home of the British Army. We're an area of 3,905 hectares. I still work in old acres, but I don't understand. At the northeast corner of Hampshire. Rushmore's population is estimated to approach 100,000 by 2018. We're not sure of those figures because the IOS, the people who actually tell us what the population figures should be, have not had those correct for the last 5 years. But having met the Secretary of State, he has promised me those anomalies will be ironed out very shortly. We're a young population, including me, 72% under the age of 50. Oh, sorry, I made a mistake there. Impact of the military population is well regarded. I've just been talking to our friend over there who knows more about the history of Aldershot than I do, but he will tell you how proud we are of everybody that served in our armed forces. But, like anywhere else, we're getting an increasing number of older people, and we know that the population will grow by 10%, but more importantly by 30% in Aldershot because of the Aldershot urban extension. And that's about 4,500 houses for families over the next 15 years. Now, is Rushmore a good place to work? Well, it is, because we've got 46,000 jobs. We're in a very accessible place, good rail links, good motorways, and a lot of people want to come and talk to us about moving their companies here. We also have the Farnborough Airport, which I don't know if you know is the leading business aircraft airport in Europe, and we're very proud of that.
So we mapped the existing provision against the things that we developed, and we developed our priority actions to deliver in partnership. I'll tell you what they are in a minute. So in deriving our health priorities, we derive them from the work of the Rushmore Strategic Partnership, the partners that Peter referred to earlier on, the Joint Strategic Needs Assessment. You've probably seen Rushmore's health profile. If you can Google Rushmore's health profile, and it provides you with a 4-side A4 document with lots of pretty graphs on it that tells you where the particular issues that this borough are. Whichever area you live in, wherever you come from, that will provide you with a really good evidence base of information. The council produces its own borough portrait. Obviously it's important for the many services that we offer that we know where the key areas of need are. So we have our own borough portrait. And local knowledge is really important at officer level, but also particularly through the members, the political members, have an incredible resource of local knowledge from their constituents. And the work that we do contributes towards various different strategies listed here, but we've mentioned them previously. These are the things that really stick out in our borough in terms of public health need. And I'm really, really pleased that mental health is in there too, because we see that coming through at a number of different levels. But healthy weight, obesity, it's an issue that we share with an awful lot of areas, but it's true at children and adult level. And the services that we provide, that we coordinate on, need to address that particular concern. Smoking's a real problem in the borough. We know how much more quickly people will suffer mortality and morbidity. People will die early if they smoke. A lot of work that we do in this area is trying to encourage people to quit. And indeed, I don't know how many of you are going along to the wonderful Victoria Day this weekend. Yeah, and I will be parading down the streets of Aldershot dressed as Big Sig, okay, a 6-foot cigarette costume. Why? Because it's important to carry the message that if you give up smoking, it's one of the most important things that you can do for your health. It's a living. Drugs and alcohol is clearly an issue as well. Mental health, as we've said, and teenage pregnancy. And how do we map these things? You know, I'm inspired by what's happening today, because we can only work with the evidence and with the partners that there are in this room. And the more people that are prepared to engage with us, and the more we outreach to people and provide resources, and perhaps money, although money's really tight these days, but the contacts that we have in the very multitudinous services that we provide can support the work of all of your services. So I challenge you today to think about how we can work in partnership together to deliver these things, because we'll all be very proud of our parochial services. Personally, I think food inspections are wonderful because I deliver them and my team delivers them. Yeah, but when I'm there delivering a food inspection, what public health messages can be carried in with the badge that gets us into premises around healthy weights and smoking and obesity? The agenda these days is challenging us to think about the need and the delivery.
non-stop oldies after the 3 o'clock news, and I don't listen to the celebrity guests. All I listen to is a bit of music and a bit of chat. EastEnders and Switer. Yeah, Switer is Steve right in the afternoon. Like if I comment on Facebook, I say Switer because I try to be quite professional. And EastEnders I seem to be quite obsessed with, whereas some people...
It's been 50 years in the making, for me personally, that we can start to have this type of engagement. Myself, I suffer from, well, I was diagnosed in the box of bipolar and severe depression. I won't talk too much about it because we all got our own problems. But what I can say is both Colette and I have been through the full gauntlet, you know, so to speak, of being ignored by society, being frustrated within ourselves, and finding it also difficult to do what we're doing now. I may come across confident, brash, humoristic, unfunny, obtuse, overbearing. Yes, I'm a Southampton Football Club supporter. Went up this year. Any Portsmouth fans here? You leave now. But that was part of it, isn't it? You know, if you belong to one thing, you're accepted there. And one thing I've learned in my 50 years, and certainly within the last 7, when I started to get really involved with voluntary work because I was deemed unfit to work or no longer required by, you know, by society, as I sometimes felt. This project that Sarah and her colleagues have formulated and so graciously invited the likes of a couple of pair of ragamuffins like myself and Colette, James and now Joanna McPherson, to some reason ask for our advice. And for people who normally have to fight to have their voices heard, unfortunately, yeah, and sometimes we do get it wrong because we don't know sometimes how to interact perhaps, it can create problems and it can create issues for everybody who's involved within who you're talking with, etc. Because it's the great void of not understanding, yeah, or